Good morning. My name is Brian Mayberry. I will be a student nurse this morning, and I will be conducting your physical assessment. Before we get started, I'm going to wash my hands. What is your name? Where are you right now? And what day is it? Patient is A&O times 3. On a scale of 0 to 10, with 10 being the worst pain of your life, and 0 being no pain at all, please rate your pain right now. I'll inspect the head and face for symmetry, lesions, skin tone, or hair loss. I'm palpating the scalp for any edema or tenderness. I instruct the patient to puff out their cheeks, smile, and frown. If the patient is able to follow the commands with coordinated and symmetrical movement, then the cranial nerve 7, the facial nerve, is intact. I inspect the eyes for symmetry of eyebrows and eyelids. Sclera should be white with no sign of jaundice. Pulling down on the lower eyelid, the conjunctiva should be pink with no sign of pallor or cyanosis. Using a pen light, I test to see if the pupils are equal, round, reactive to light. I have the patient look at the tip of my pen, move it towards them, check for accommodation, and then I shine the light at looking at both eyes to assess for corneal light reflex. I inspect the ears for symmetry, erythema, drainage, or any foreign objects. I inspect the nose for symmetry and press up on the nose to inspect the nasal mucosa for drainage, color, or lesions. I inspect the lips, have the patient open their mouth, inspect the hard and soft palates and the buccal mucosa for color and lesions. I inspect the dentition for caries and the gum for erythema or bleeding. I have the patient stick out their tongue. If it travels midline, the cranial nerve 12, the hypoglossal nerve, is intact. Using a tongue blade, I depress the patient's tongue, have the patient state ah, and I note that the tonsils are a grade of 0 to +2, and the uvula rises midline. Cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, the vagus nerve, are intact. I inspect the throat for lesions, lumps, pulsations, and the patient at 30 degrees, inspect for JVD, and I look for tracheal deviation. I palpate the carotid arteries, one at a time, and grade them from 0 to 4+. I inspect the anterior and posterior thorax for symmetry, unlabored breathing, lesions, and I feel for temperature, bilaterally and anterior and posterior. I pinch the skin above the clavicle to test for turgor. Anteriorly, I'll auscultate the lungs at the left and right apex above the clavicle. In the right mid-axilla and the right and left apexes. Have the patients take a deep breath for each location. In the posterior, I also take the left and right apex above the scapula and the left and right bases below the scapula. Again, having the patient take a deep breath at each location. I palpate the apical pulse at the 4th or 5th intercostal space, left midclavicular line. I'll auscultate the apical pulse for rate and rhythm. Rate is 60 beats per minute, regular rhythm. Using the diaphragm with the stethoscope, I'll auscultate the heart sounds in the aortic area in the 2nd intercostal space on the right sternal border, the pulmonic area in the 2nd intercostal space on the left sternal border, the tricuspid area in the 5th intercostal space on the left sternal border, and the mitral area in the 5th intercostal space midclavicular line. I then repeat those auscultations with the bell of the stethoscope. I'll have the patient lay supine. I inspect the abdomen for contour, symmetry, color, lesions, or hernias, especially around the umbilical area. I feel for equal bilateral temperature. I will auscultate for bowel sounds, starting in the right lower quadrant, moving clockwise, right upper quadrant, left upper quadrant, and left lower quadrant. I will then palpate all 4 quadrants in that same order with shallow and then deep palpations. I'll then sit the patient back up. I'll inspect the upper extremities for symmetry, lesions, skin color, and equal temperature. I'll assess bilateral radial pulses, grading them from a 0 to 4+. I assess bilateral grip strength and capillary refill. I'll inspect the lower extremities for symmetry, lesions, skin color, and equal temperature. I'll assess for pretibial edema by pushing against the shins, releasing and observing for pitting. I assess equal strength while the patient dorsiflexes and plantar flexes against resistance. I'll palpate posterior tibial pulses and pedal pulses bilaterally, grading them from the 0 to 4+, and then I will check capillary refill.